Good afternoon. Welcome to Neethu's Academy Reading Live. I am Vinod James. You can see that I'm so excited, isn't it? It's because yesterday was another lovely day where about 100 plus students again made to their dream country. What else as a trainer, as a family member, what else could you ask for more, isn't it? And the students who have scored, we always say that how to get that 400, isn't it? And you can see that a lot of students have scored that 400 barrier, which is an absolute stunning feel that you get. And when that student calls us and all, it's an awesome feel because you could really feel that intensity of that great happiness inside them and that excitement, all those things. It's absolutely a mixed feel that you get when a student calls and says, I got this score and it was something which was so much difficult and all those things. It is absolutely their hard work. Nothing is gonna replace of their hard work. It's absolutely so. Congratulations to all of our lovely students who have made to about 120 odd students and counting. Okay. So it's absolutely so nice to come the very next day after the result gets, because we have a lot of lovely, happy faces that is always there in front of us. Shine Johnson, good afternoon. Monica Vegas, good afternoon. Sidhu, good afternoon. Arun Ravi, good afternoon. Atira Sally, good afternoon. A very, very, very good afternoon to all of you, no matter wherever you are from. So a good morning, a very good afternoon, and a very good evening to all of you. So did you all see that link which has been shared? It's so nice, isn't it? You see those lovely faces from different parts of the world. And 𝐿𝐶𝐵His, good afternoon. So how many of you have kept your pictures ready? That I will also have my picture there in Neethu's Academy page. How many of you have kept your pictures ready? Saying that, okay, I will also have my picture there. Yes, Monica, yes, Sane, okay. Good enough, good enough. I want all of you to let me know if anybody have kept your picture ready to make sure that, okay, I will have my picture there saying that these are my absolutely stunning scores. Shiny BS, good afternoon. So nice to see at least one icon next to your name. So if you have not yet joined our page, hope next month my name also will be popping up there. It will be, Monica. Do not worry, because it is what your hard work, because all of you are so much hardworking students. So definitely it is going to reap you benefits. Jeffy Andrews, good afternoon. Renita Johan, good afternoon. Sanita Sabu, good afternoon. Good. Rajita Rajan, good afternoon. So nice to see at least one icon next, as I mentioned. If you have not yet followed our page, please do follow. If you have not yet liked our page, please do like the page button. If you have not yet joined our Telegram pages, please do join. If you have not yet joined our WhatsApp channel, please do join so that you do not miss any important insight that Neethu's Academy wants to tell you, or any of the the live sessions that we do, because you wanted, and we are obliging to you because we are improving on a daily basis. We are increasing our live sessions. We are adding on a lot of new things that is going to be of great benefit to you, is what we feel. So if you have not yet, you do not want to miss, please do join so that it's always there at your fingertip. Sobi, good morning. Ashley Jones, good afternoon. Kavita Balaji, good afternoon. Right, Aringilondo, who's attending the live for the very first time. Is there anybody who's attending the live for the very first time? If so, please do let me know. Now, what is the importance? Today we're going to go back to how to score. Okay, it's quite stunning, to see those lovely figures of 400 and above. And I always adore students who have scored about 450, 460, especially in writing, and all. To score about 350 itself is stunning. There were n number of students who have scored about 400, 420, 420, 410 and all. So that means anything is possible when you really invest onto it. Invest in the sense your time. Now, what are the things? Now, today we're going to talk about, again, back to how to get this 400. Okay, see, 400 in reading is never a score which is not achievable. It is easily achievable. Okay, in order to achieve it, yes, of course, you have to invest certain things. What is the thing that you're going to invest? You're going to invest on practicing. That means habits. Clarina Fernandez, good evening. Libya, good morning. Anita Prabhu, good afternoon. So what are the things that you have to do in order to enhance your comprehension skills? See, generally what happens, we read, which I have already mentioned, the aspect of why we are not able to understand what we read. And that is what that hindrance is between you and your 400. Because generally what happens, if you ask a student, okay, these are all from my experience with dealing with whenever I take classes, what I do is I observe when a student comes and says something. Okay, see, the general thing that you have to, and Neetu George, good afternoon. How am I? I'm doing so happy today because a lot of students have made to their dreams. So what else could we ask for, isn't it? So thank you very much for asking. I hope all of you are doing good as well. Adam Vipin, good afternoon. Reshma Sajid, good evening. Good. So nobody have told me that you're attending new. So that means you were all here on or before, isn't it? Fair enough. Now, back to importance of, see, when a student says, okay, see, what happens is, even though they don't understand, see, they have absolutely talent. Okay, just that fine-tuning, that thing is not happening with it. Okay, in order to fine-tune what you have, you should have a habit of reading. And then you should know the difference between each text. Sandhya C. Gopi, good afternoon. Divya Ji, good evening. Saumya Sijin, good afternoon. Reshma Sajid, good afternoon. That fine-tuning. Okay, so you should know the basic structure. Okay, so Alpana Bijumun, good afternoon. So the structure, what is the purpose, what are you intend to find in that particular text is something which is pivotal. So you have to understand the basic structure in order to get that. You should know, okay, part A, what is my purpose? Part B, what are you to read? Part C, what are you to read? What's the difference between part A to part B to part C? What are you searching for? If you can differentiate that and put it into practice, okay, see, that is another important thing. Student knows, but they don't really recall it. Okay, now this is what I'm going to talk about, the importance of recalling. So in order to recall, please understand, you have to repeat it a lot of times. Okay, let's say part C. Okay, generally, whenever I'm taking the live, most of the student comes up and says, sir, can you give me tips for part C? See, the most important thing that you have to understand in order to get over that part C is a fundamental thing called reading habits. Because you should understand what you're reading. Understand? So try to, read. Don't read massive. When you ask students, oh, I read material. See, you can read material. Are you reading it with a purpose? Are you reading with a profound liking towards what you're reading? Not necessary. You're simply reading for the sake of reading. Why? Somebody said reading habit is important. It's not just about incorporating it for the sake of reading. It is to make sure that you're doing it with the purpose. What is your purpose in telling you, okay, I'm going to start reading? Okay, so you have to read on the aspect, okay, I'm reading, let's say a small paragraph. A small paragraph. After reading that paragraph, start analyzing yourself. What did I understand? Welcome to the world of comprehension. And that is the difference between C. Okay, and more you have to invest on basics, fundamentals. Okay, student doesn't even understand. See, when I enforce certain rules and all, I do have my rules and regulations in my class. Then I enforce it. Student doesn't realize. They think that it is taxing them. It is about, causing them trouble. It is not for causing them trouble. It is just to overcome the trouble. But when you have a confined approach, you don't understand the broader perspective about it. Simi, good afternoon from Qatar. Understood. See, when you are asked, when a student is being forced to do certain things, that is to make sure that they're getting over that line of making sure that they find an answer. Understand? And that is the reason why few, I'm not saying major of my students or the majority of my students understand. And they are ready to bring that change in them. There are few who think that, okay, this is not needed. Just sit and do. We are not here to do that. But the difference is between the doers and the non-doers. The doers are what you have seen today on that link that we have shared. Those are the doers who have made that difference in their life. See, we always talk about having a mundane life, very average kind. My students, I want all of them to be having a much, focus-oriented life, not a mundane, average life that anybody can do. Okay, when a student comes and says, I tell the student, when you come and say, I didn't find the answer, what is the big deal? Anybody can do. Isn't it a very mundane approach? When a student comes and says, see, I didn't find the answer, but I think this can be the answer. Something they have tried. That's a difference between triers. A person who tried, those are doers. Person who simply sit and say for the sake of saying, they will be there. And the difference is when that student reaches that dream country and sends them a snapshot saying that I have reached, that is where the difference happens. Now, the shift is only to have it on the aspect of telling yourself, see, what is my purpose? Attending a class. What is my purpose? Attending a live. What is my purpose? Attending a live session on a daily basis. Am I here to make that significant difference in my life? If you believe that, things are gonna come your way. So the only thing that you have to do in order to get over that 400 is to bring that change in you. You have to start having a focus. What am I here for? I'm here to make that difference, that small change in my life. See, I used to do normal things. It's not working for me. Now I'm going to do something which they are telling, okay, this works. Let me try it out. Please do try. That is why I would always talk about the difference between a doer and a person who is having a mundane. Understand, I want all of you to be the doer. If you try to become a doer, 400 is there in front. Okay, so that is what you're going to do in order to get that 400. Good enough, Divya, Albin, good afternoon. Ajish, good afternoon. Kalai, good afternoon. Hope you had a lovely exam, Kalai. Did you? I hope you did. Right. So now let's go back to the one that we missed yesterday, isn't it? Due to some technical glitch, there was an issue with part B. So we'll be doing part B. So are you all ready for doing part B today? Yes. If so, give me a quick thumbs up saying that I am ready and I'm going to get an answer. How many of you are saying that I'm going to have that small change in me? Let me see how many of you are going to tell me. Rabi, good afternoon. Anybody who's going to tell yourself that I'm here to bring that change? Nito George is okay, good enough. Arun Ravi is good enough. Shiny Reddy, all right. Shine Johnson, yes, good enough. Sobi Redding, all right. Adam Redding, Kalai Redding, 𝐕𝐴LBIN Redding, good enough, good enough. Savit Redding, Savit or Savit? I will, Shiny, very good. Soumya, yes, good enough. Rajita, good, ready. Because the way you respond is the only way that I could relate, even though you're all there in front of me virtually. But the way that you're going to respond, Reshma, after some time, yeah, nice to see. Alpana Reddy, Rabi Reddy, Anita Reddy, Shanita Reddy, okay, good enough, good enough. So nice to see at least one icon next to you. People who haven't, please do click. That is to show that you are there as one of the most important pillars of this family, right? So just to show that you're there supporting whatever that we're giving, that means you're happy with whatever that we're giving. That is where you click that like button, follow button, share button, subscribe button, and all those. And if you feel my classes are going to be beneficial, please do not hesitate to share that on your social media platform. Why sharing? There are a number of students who are still unaware that we give these kind of free classes. So if you can do, please do. Savit, okay, thank you. Bensi, yes. Priya, I will. Renita, yes, good enough. So please do share, yeah. All right. So now the material will be popping up. Please do the material in the given time. Do beat the time. That's the challenge. All right. Then we will discuss it. Ashley, yes, good enough. Okay, so I'm not going to waste your valuable time. And you always have to remember, if you need a professional approach, do not hesitate to contact. Our next admission starts from March, April, May. We're always there to give you support. We have a number of courses available for all the linguistic exams that is available. If you need any help, do not hesitate to contact the number. There you have the material. Please do the material and then we will discuss. Okay. Time have just gone, and I could see that Monica was the first one to say done. Sanita said done. Neetu George said done. Susan, good afternoon. Sorry for being late. Not at all a problem because here these are all times where you are managing in between, isn't it? So I completely agree. So thank you very much for popping is what I would definitely tell my lovely students. Sidhu done, Ria done, Shiny done, Shine Johnson done, 𝐕𝐴LBIN done, Reshma done, Renita done. Okay, good enough. I like the way that you respond. See, the more you respond, it makes us more eager because you are so much of an importance for us. Rabi done, Sobi done. Good enough. Now, Arun Ravi done. Now, my next question. What is the answer? Where you got that answer? Okay, please be kind enough to tell me where you got that answer from. That where is very important. Okay, because we always believe in coming and correcting if needed from where you went wrong. Okay, in order for us to correct, you should tell why that answer and where you got. Need to see from first para. Okay, fair enough. So I have my first answer. Adam is saying A from second para. Divya is saying C from second para. So this is where that diversity happens, isn't it? See, Nikhil said C from first para. Divya said C from second para. Adam said A from second para. So anything is a possibility. See, all those three options. The exams that they when they designed the material, all those three answer options are possible, provided you read in accordingly. Kavita done. Okay, fair enough. I want all of you to tell me what are your answers and where you got that answer from. Arun Ravi, C from second para. Okay, fair enough. Sanita, A from first para. Okay. So I have the option between C and A. Good enough. How about others? See, please do not refrain yourself. See, this is where you have to bring that change. I'm here to comment whatever I've got. Whomever finds or which my answer right or wrong, doesn't matter. I'm here to get it corrected. If it goes wrong, if it gets right, you take that appreciation. Both ways you're benefited. Ashley Joe, C from second. Okay, fair enough. Renita, C from second para. Okay. So generally now C is overtaking A. So Simia Jaikatar is saying A. Okay. Reha, good evening. A from second para. Okay, fair enough. Right. Now let's go and see what is the answer or why the other ones are not the answers. So the material will be popping up. So in order to do part B, you always have to remember you are expected or you are to read the question first. Please read the question, understand the question, underline the keywords in the question. Very, very, very important. So as you read the question, underline the keywords and please always try to limit your keywords for 2 or to 3 words, not sentences. Okay, still student doesn't understand. Why? Because they feel that, okay, this is all what I need to see. When you underline like that, your eyes are not going to catch what is needed. Okay, and you're going to waste time. See, keyword should be practiced on the aspect of, okay, that particular word that gives me the answer options. So be A from last para, Rajita A from first para. Okay, fair enough. Now A is also there, competing almost similar to C. Now you always have to tell yourself, okay, as I mentioned, in order to get over that 400, in order to get over that small hindrance that you're keeping in front of you, you have to start coming out of that comfort zone. Okay. Right. Rajita Rajan A from first para. So basically it is either first para or second para is what you're saying, but the same answers are popping up from both places. Now let's see what the question has in store for us. So the question is saying the guidelines informs us that pregnancy testing. Okay. I've always reminded when you're reading B, you should relate it to your question. So informs us that pregnancy testing should be conducted in accordance to the established procedure. So it should follow certain rules and regulations. Pregnancy testing may result in scheduled treatment being postponed or cancelled. So treatment postponed, cancelled. Pregnancy testing is compulsory for any woman, that any is very important, who suspects that she may be pregnant. Now, 3 options. Now I'm going to read the paragraph. Elimination method is the most appropriate methodology to find the right answer. Because generally, the options to eliminate can be easily found rather than the answer. Because you try to somehow make that answer the way that you like to. That's where you're going to. So anesthesia and pregnancy testing. All women of childbearing age should be sensitively questioned on the day of surgery as to whether there is a possibility that they could be pregnant. So who should be asked? All childbearing age people. So not all the women, childbearing age. That they could be pregnant. So it's a possibility. Okay. So is compulsory for any woman? This is a problem for me. Okay. Childbearing is a problem. Only that particular age women. So all women, any women is not. Okay. Women who could possibly be pregnant should be informed of the risk and pregnancy test should be discussed. Okay. Now, pregnancy test should be only carried out on women who may be pregnant with their consent. So, something they should be, and any relevant discussion should be documented in the clinical notes. So, they're talking about what is the procedure to follow. So, slightly A for me. There should be locally agreed policies on the administration and checking of pregnancy tests prior to surgery. So the guideline informs us that pregnancy testing should be conducted in accordance to the established procedure. That is what second part of the paragraph is going to talk about. May result in scheduled treatment being postponed or cancelled is a straight eliminator because it's not mentioned. Is compulsory. Now this is a problem. Where are they saying compulsory for any women? All women of childbearing age should be asked. That's all. They are not saying it is compulsory. Compulsory is also a problem there, isn't it? Who suspect that she may be pregnant. So not all women, and it's not compulsory, it's not mandatory. Only childbearing. That means that particular age women. So this is not the answer. So congratulations for all the people who have got A, because A is the right answer. And you're going to bubble the appropriate letter. Reshma is saying C can be directly eliminated. Fair enough. Asha Sibin A. Fair enough. Any doubts? Maria A. Okay, fair enough. Keep on dancing. Reha Vasapin. Finally, this time my answer is correct. Good enough, Reha. See, you should enjoy your achievement. Then you'll start learning. You'll start finding that all the answers that you're going to get once you start enjoying what you're doing is going to be correct because you all have the ability. Kavita got it. Asha 7 dancing. Keep on dancing. You should start enjoying your achievement. Any doubts? Need to understood? Good enough. Any doubts with regards to what I've explained or anything that you want me to clarify? Rabi dancing, good enough. Neetu George, understood. Good. Because you have understood, now let's go into the next thing. So what is next thing? We're going to talk about part A. So part A, I've already shared, it is rectal prolapse surgery. Now my question to you is, one important thing, okay? I want you to tell me how you felt about the material. See, please do give us some insights because after your comments only, Neetu Madam will be making the next material. So please be kind enough to let us know what you felt about the material, how you felt about the material. Do not worry about what others are saying. I want all of you to be on your own saying that, okay, see, this is what I felt. Fair enough. Maria is saying easy 13 minutes. Okay, fair enough. And also I want the time. So like what Maria said, easy 13 minutes. Fair enough. Ria Robin, Rohan, clear? Okay. Shiny is saying easy. Good enough. Neetu George, it is like okay, but not easy. Fair enough. Reshma happy. Okay, fair enough. How about others? Give us some insights. Shiny saying easy. Ria is saying bit tough, but where is the time? I want you to tell me the time that you have completed. Renita, easy 14 minutes. Savit, tough 13 minutes. Okay. Sanita, easy 16 minutes. Okay. Kavita Balaji, easy 12 minutes. Good enough. Tell me. See, do not refrain yourself. Okay. That is something that you are doing. Although there are a number of fraudulent people, that is not the one that I'm talking. But apart from that, you should know that what is your purpose. And when people contact you, these fraudulent people will contact you, please do not respond. Just simply block them and report them. We will not contact you on the aspect of call us, message me that this, you want that, we will give you. We will not do. That's why we are coming straight. Whatever 𝐻𝐿 Academy want to come and tell you, we'll come and straight onto the live and tell you. Ashley Joe, 16 minutes stuff, KS, everything is clear. Very good. Right. Now let's go and see what part A has in store for you, because although not majority of the people have given me an insight, but still I always appreciate a student who takes that extra effort in order to let us know. Right, when the material pops up, we're going to do part A. So part A is very different to part B because the purpose is different, the strategy is different, everything is different about each of the text. Okay, so in part A, the strategy is called skimming and scanning. In order to do skimming, you are only having 1 to 2 minutes. But I would say, because we have a strategy of 8 minutes, so 15 seconds is what you take in order to skim through each text. Scanning, of course, only once you need the area to be scanned, that's the time that you scan. Apart from that, don't scan. Okay, you will have 4 texts based on one common theme. Okay, 15 minutes, 20 questions. These are the important aspects, and do not touch the material before they tell you. And please always try to use pencils. There are students who use highlighters, there are students who use pens and all. Please do not use some fancy things and all. Okay, you are here with the purpose. And what you practice, always think that, okay, this is how I'm going to do on the day of exam. Right, so skimming, what are the things that you have to do? I've already told you what are the important things on the aspect of how to skim. What are the important things that you have to underline? I'm just going to show again. So rectal prolapse surgery is a procedure to repair the rectal prolapse. The rectal prolapse is where the rectum of the bowel is stretched and bulging at the bottom of the anus, and this is the weakness of the muscular pelvic floor and the ligament support of the rectum sometimes. When the bowel is open and goes back itself, and rectum is published and pushed back, and even when 3 types of rectal prolapse, full thickness and full thickness and rectal through anus, mucus in the entire wall of the internal purpose of the intestine, which falls into section. This could have age, chronic straining, pregnancy, bowel, neurological dementia, weakness of the pelvic floor. Done. Understood? Tarun Balakrishnan, hi. Likewise, you're going to skim through all the text. Okay? So you have to always remember, you have to go through it. Okay? Then you're going to do, okay, an intravenous drug is attended to cannula, so all those in fine needle, the purpose and take oxygen, and when spine is clipped and the finger doesn't do, the heart rate monitor and becomes sticky pads, and sometimes leads. Likewise, go through it. Now, options text C, it is going to talk about diagnosis. So any diagnostic methods are mentioned in text C, and D, complication. So any complication related to rectal prolapse is mentioned in C. This is how you differentiate. After this, you're going to go to the question. So you have to understand 20 questions. Again, I repeat, because repetition is the mother of learning. 20 questions are divided into 3 sets of questions. So this should be by hearted by each of my students. 1 to 7, these are called match the following question, where your answer can be either A, B, C, or D. And you may use any of these letters more than once. If your skimming is proper, again, let me remind all of you, part A is a piece of cake. I'll show you why. See, the thinking impairment disorder, that can be a causative factor. So where are they talking about? The causative factors, which can be about thinking. Thinking means Neurological, isn't it? Something to do with your neurological thing. So where are they talking? Neurological disorder, dementia. So the answer is A. Clear? Apparatus, that means some equipment, device, anything can be engaged to gauge oxygen level in blood during surgery. So during surgery, where do you think? It should definitely be in B, isn't it? Is it there in B? It is there. Is it? Yes or no? Yes, it is there, because this means that the excess lining is removed, you're monitoring, and this leads to some, where am I reading? Yeah, see, it is saying your pulse will take, okay, it into the amount of oxygen in your blood and measured using a special clip. So the answer is B. Now, various methodologies to identifying. So what are the ways to identify? Diagnosis, I'm not going to even refer. C. Why is the surgical procedure conducted without the necessity of distinctive incisions? So where are they talking about all these incisions and all? That should be definitely in B again. So where are they talking about there should not be any cut? So there is no external cut required. So the answer is B. Elements contributing to the occurrence of different types. Where are they talking about types? Only one place. A. Do not worry about it. Challenges entailed. That means associated. In surgical intervention. So where are they talking about surgical intervention? Definitely a complication. So where are they talking about complication with regards to surgical intervention? It is there in C. So surgery complication. So the answer is very straight. This is why keywords. Diagnostic assessment utilizing imaging technology. So where are they talking about diagnosis? C. No need to waste your valuable time. The next set of questions, these are called short answer question, where the question number starts from 8 to 14. It can be a word, it can be a short phrase, that means 2 to 3 words, number or numbers or both. Okay, I could see a lot of comments because there was some glitch happening, so I was not able to read your comments. Renita 7, Anita 7, good enough, keep it up. So strategy remains the same, underlining keywords again. How is the type? So where are they talking about type? It's there in A. So go to A, characterized by intestine folds into. So they are saying 3 types are there. There is no folding. Here folds into section into it. So what is the type? Internal. INTERNAL. Good enough. Which instrument is employed in the diagnostic procedure known as colonoscopy? Okay, facilitating visualization. So what is the instrument? Go to diagnostic method. So colonoscopy is there. What is the instrument which can view? Colonoscope. COLONOSCOPE. Anita 7, Kavita 7. Good enough. Keep it up. What is the optimal approach to evaluate the efficacy of muscles in nerves in rectum? So what is the ultimate method to assess? So again, diagnosis. Now the next keywords. What are the next keywords? It is rectum is there, muscle is there, nerve is there. So what is the ultimate method? Electromyography, or you can write EMG, because they have given the abbreviation. Once they have given the abbreviation, you are always welcome to use abbreviation to manage time. Good enough. During the rectal prolapse surgery, what is the major concern arises from the potential injury to which nerve? So complication, which nerve? So definitely go to the, so injury to hypogastric nerve is already given in the question. So the answer should only have hypogastric, HYPOGASTRIC, causing importance. Good enough. Now to reveal the muscle of the bowel wall, what is excised? That means cut from the prolapse. So something has been taken off. What is that? So go to D again. Is it? The question is what? To reveal. So question number 12, it's saying to reveal something has been excised. So go to B. What are they saying? What is removed? What is removed? The muscle, the excess lining or the mucosa is removed from the prolapse to expose the muscle of the bowel wall. So either you can write mucosa, M-U-C-O-S-A, or even excess lining, not a problem, but the safest one is mucosa. Good enough. Now question 13. What condition? Condition means something. So please include mode, purpose and memo-based question. Okay. Include may ensue. Ensue means follow colon and rectum injury in rectal prolapse surgery. So where are they talking about these two? Definitely go to complication. So injury to rectum and colon causing facial fistula. F-A-C-E-A-L-F-I-S-T-U-L-A is the answer. During surgery, what apparatus is fixed to the chest to monitor and record heart rate? So something is done to check. So I know that your heart rate will be monitored by placing sticky pads, okay, to your chest. So the answer is sticky pads, S-T-I-C-K-Y-P-A-D-S. Now the final set of questions, these are called fill in the blanks question, where your instruction says it can be between 15 to 20. Very similar kind of instruction as you get in short answer. The only thing is redundancy. An article redundancy also is considered to be wrong, so be aware of it. Only what is missing you are expected to write. In dash of instances, a prevalent change following the rectal prolapse repair in the inadequacy of correcting continence. So where are they talking about all these keywords? So these keywords are mentioned where? Again in complication. So improper correction of continence occurs in 50% of cases. So the answer is 50%. Question 16. Debility. Okay. Sorry. In the dash and supporting ligament lead to protrusions or dilation of terminal segment of the rectum. So stretching. Okay. And debility is weakness. Okay. So weakness, where are they talking about? It should be there somewhere in A. Okay. Where are they saying? This could occur because of the weakness in the muscular pelvic floor. So what is the answer? It is a 3-word answer, muscular pelvic floor. Good enough. Good. You're all catching all the good words, is it? Surgery of rectal prolapse necessitates no external incision. So we have already done this, isn't it? There was some place where entity of the repair is accomplished through the dash. So where are they? We can't talk about it. Is there in B. Why? Because no cuts and all is there. So what are you? The muscle is then stitched. So where are they? What is that thing? Okay. So the answer is rectum, is it? Where, sorry, not in, what do you call it? Here, the muscle is there stretched to repair the prolapse, and this is done via the anus, and no external cut is required. So it is done through anus, A-N-U-S. Now question 18. Repositioning may be needed in heightened case, that means severe cases, for bowel manipulation or rectal prolapse may persist. Persist means it continues. So where are they talking about? In A, it is saying in heightened cases, the rectum may need to be pushed back into the bowel after it is open. So the answer is rectum. R-E-C-T-U-M. Good enough? The penultimate question. In dash, a slender, thin, thermometer-sized tube, deflated balloon, measure the rectum response to pressure. So in some particular thing, what are they talking about? Where are they talking about this? So go to C. So The doctor uses a flexible tube, okay, small size, thermometer, deflated balloon. So anorectal manometry. ANORECTAL is the answer. The ultimate question. The opaque dashed liquid gives rectally exhibit visibility X-rays yielding distinct images on the targeted region. So opaque, liquid, X-ray, where are they talking about? Again, go to C. So X-ray is there, liquid is here, okay. All those other keywords are there. Chalky means opaque, it's not clear. Now, what is the only thing missing? Containing barium, B-A-R-I-U-M. Very good. So I have wrapped my 20 answers. If you have any doubts with regards to any of those questions that you want me to clarify, please be kind enough to ask. If not, do shoot me your total scores. Let's see, because most of you have written the right answers. So I'm quite eager to see what are scores that I put. Kavita Balaji, the first one to say 20 out of 20. Absolutely good enough. Keep it up, keep it up. Maria Chinnabatini, 20 out of 20. Absolutely good enough. Keep it up, keep it up. Good, good, good. Alpana, 20 out of 20. Very good. After some time, I'm seeing a lot of 20s coming up my way. Good enough. Keep it out. It's all your hard work, isn't it? So keep on patting him back and say, good enough. Renita, 20 out of 20. Absolutely good enough. Atira, 19 out of 20. Good enough, good enough. Keep it up. Good, 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 good. So I don't see any doubts and all coming, and people are a bit reluctant to message. Maybe I don't know why it is, but so let me take the opportunity to thank each one of you on behalf of Neethu's family. Thank you very much for giving us another lovely day with your active participation. Until and unless I see you all tomorrow, adios from me. God bless you all. Take care.